Hello, good morning, viewers at home and around the world. We welcome you to today's episode of Health Matter on WAP TV. Today is the 20th of March 2021, and today the world celebrates the World Oral Health Day. And the theme of this year's Oral World Health Day is Be Proud of Your Mouth. Be proud of your mouth. And we meet today in the studio. On my right, I have a professor, an expert on the field, and the person of Professor Omowunmi Ayanbadejo. She is a consultant periodontologist. She works with Luth. And on the left, I have Dr. Oluwarotimi Akanbi Clement. He is a consultant oral and maxillofacial surgeon. He also works with Luth. And this morning, we'll be looking at the topic, how can we be proud of our mouth? A good number of us may not know that poor oral health or poor oral hygiene can actually lead to systemic infection that can affect our overall health. And of course, that may become an underlying illness that can predispose each and every one of us to having a bad outcome should we get infected with COVID-19. Don't forget that we are still in an active pandemic. And it's on that note that I want to say a big welcome to Prof. You're welcome, ma.
Thank you very much. Good morning, viewers.
And Chief, you're welcome, sir.
Thank you very much.
Okay, so let me start from you, ma. What is Oral World Health Day all about?
Okay.
Thank you very much, ma.
Thank you. World Oral Health Day is a day dedicated worldwide for us to have some knowledge of common diseases that affect the mouth, how to prevent it, and how it can also affect our general health. It is a day created from the numbers 320. In other words, what it means is that adults should have 32 teeth and no dental decay or no hole on the teeth. So if you look at those numbers, you will see 3 represent the month and the 20 represent the date. So that is how come the World Oral Health Day was decided on this day of this month. I would hand over to my colleague to say more.
Thank you very much. Dr. Clem, over to you, sir.
Yeah. Talking about our World Oral Health Day, it is a day to commemorate oral health. And it's a popular saying in our profession that the mouth is a gateway to the body. And when you look at the mouth, sometimes the mouth speaks about the overall health of that individual. And I will also say that most times when patient comes to the clinic, we tend to discover a lot of ailments in the mouth, which could be nipped in the bud before they become full-blown. And before now, some years ago, the awareness of oral health is quite poor, but I want to say that in the last 10, 15 years, we've been celebrating World Oral Health Day in Nigeria. If I want to say that in the last 3 years, the World Dental Body, that's the FDI, and Nigeria as a nation, we've been coming first when it comes to the celebration of World Oral Health. So it is a day that will tend to increase the awareness to tell the whole world, especially in our climate here, to tell Nigerians that you don't have to wait until you have pain. You don't have to wait until there's a particular challenge in your mouth. You need to walk up to the dental clinic on a regular note so that you will know your health status and be able to take care of your mouth so that you will be able to live long, because we also equate good oral health status to long life.
Thank you very much, sir. Now, ma, to To the man on the street, what are some of the symptoms of dental and oral problems, okay, that could be a warning sign when such a person notices any of them? What do we look out for?
Well, there are some common diseases. The commonest one being more gum diseases amongst Nigerians. The following one will be dental decay, or what we call dental caries, or to the layman, hole in the tooth. Now, for gum diseases, what will happen is that when patients or when people brush their teeth, they begin to notice blood coming out when they are washing. That is a sign that there is early gum disease. Other signs too could be that the teeth may be shaking and the teeth will fall out. That falling out is not a sign of old age. It is not a cause of aging. It is a sign that there is disease. When it comes to dental decay, there will be a hole on the tooth. Patients will say that they are not able to drink cold water anymore, that one area of the mouth is really hurting them or paining them. Sometimes if that hole in the tooth is left too big and is left for a long time, it can get to the root of the tooth where it is seated in the bone and cause a big swelling. And that swelling sometimes could be dangerous to health. So we don't want people to get to that stage. Other diseases too that are present now are some diseases that people are born with, like where people have incomplete mouth lip formation or hole in on the top of the mouth. In those cases, now those conditions are treated in many centers around the country, including Luth, under the program called Smile Train, and the treatment is free. We are seeing a lot of people bringing their children into these centers to have them treated, and of course it will end up with a beautiful smile, and for them and the parents to be proud of.
Thank you very much, ma'am. And I would like Dr. Oluwarotimi to talk to us about the causes of dental and oral diseases. What are the common causes that we have in this environment, sir?
Common causes of dental disease, as Prof has earlier said, could be categorized majorly into two aspects. In the layman language, you have the one that affect the gum, and the one that affect the gum in the mouth, and also we have the one that affects the hard tooth structure, which is the enamel dentin, and eventually getting to the pulp. So for the gum disease, that has to do with what we call poor oral hygiene. If an individual fails to brush his or her mouth regularly and to brush with the appropriate toothpaste, then definitely such a one will come down with gum disease. And also the second one, that one that's the caries, the hole on the tooth. That has to do with interplay of some factors. Number one, we call it refined sugar. When you take a refined meal that contains refined sugar, example, soft drinks, your chocolates, your soda, that's and all those things, definitely is not even the quantity of what you take from those particular items. It is the frequency. Let me give this scenario. Waking up in the morning, you have a fresh, clean your mouth. Before you go to work, you take a good tea or coffee with milk, laden with milk and sugar. While on your way, you are licking tom-tom. When you go to the office, let me have, while you're in the meeting, bottle of soft drinks. For about 8, 9, 10 hours, the continuous challenge, you're challenging your mouth with those sugary substances. If you do that consistently for 1 month, 2, 3 months, you come down with caries, cavities on your tooth. So refined sugar you're not taking balanced diet, or for that will affect your immune system. So if the immune system is compromised, that will also predispose the individual to dental caries and also even to the gum diseases. And then you have susceptible teeth. So, you know, the formation of those teeth in the mouth also predispose an individual to dental caries or holes on the tooth. So if you don't take care of all these factors I've mentioned, definitely the person will come down at one point in time or the other in one's life with dental diseases.
Let me also add.
Yes, go ahead, ma'am.
To add to what my colleague has said also is that those sugars, as much as possible, we are trying to encourage oral health for healthy bodies as well. So what this means is that also when we don't eat too much sugar, we're eating a balanced diet, but with low sugar in the diet. We are not also preventing dental decay or hole in the teeth. We are also preventing diseases in the body like excess weight or even diabetes mellitus as well. We don't want people to have diabetes so that they can live healthier and longer lives. More so, things like smoking. Smoking too can cause diseases in the mouth. It can stain the teeth. It can make the mouth smelly. It can make people not want to eat properly. So, and in addition to that, it can also cause cancer in the mouth. And also, it can also cause lung cancer. So in addition to just cleaning your teeth, it's not only, you're not just cleaning your teeth, you're cleaning your teeth for your well-being, so that you're well.
Thank you very much, ma'am. Talking about smoking, I do also know that some people chew tobacco. Okay, but we're back on a short break. When we come back, we'll take it off from there. Go nowhere. Thank you. Yes, we are glad to have you back. Welcome back to the show. At this juncture, I would like to open the phone lines. The phone lines will be shown on our screen now. So viewers at home, you're free to call in, ask your question, should there be any, or make your contribution. Okay? We are talking about World Oral Health Day today. Today is the 20th of March, usually done or celebrated every 20th of March every year. Okay? And before we went on that break, I actually asked a question. Prof was talking about smoking, the link between it and oral health, oral disease. And I also asked a question on tobacco, because we do know that some parts of Nigeria, a good number of our elderly population or senior citizens, oftentimes we see them chewing tobacco. The young men smoke it, the elderly ones chew it. What can you say on that, sir?
Yeah, talking about tobacco is this, as we all know that one cannot really lay hand on the cause or causes of oral cancer or other cancers in the part of the body. But over the years, what we know is predisposing factor. And tobacco is a very, very prominent one. The role it plays for an individual to have one form of cancer or the other. So chewing tobacco with some other ingredients like all these aluminum or this metallic, whatever they wrap with the leaf, the tobacco leaf, all those things tend to predispose an individual to oral cancer or cancer of along the oropharynx, or even from lung cancer. So it's really predisposed one to oral cancer, and we want to discourage that. If you think you need to snack, then go on healthy snacking. I mean, take in between meals, you take fruits that will be really healthy and will give you a good health, not smoking or taking tobacco in any form. Because we know some chew it, some through pipe, some the raw smoking, all that will predispose an individual to oral cancer or other cancers of the part of the body.
Thank you very much. Thank you very much, sir. Prof, I'll come to you. Is there any link between COVID-19 and oral diseases?
Yes. First of all, the virus, we share a common pathway with where the virus is commonly found, around the throat or the oropharynx. Then secondly, more recently, some researchers found out that those who have gum disease, were more, particularly the severe type of gum disease, where it has started affecting the gums to a point where the teeth begin to shake, called periodontitis. They found out that patients, that they looked at patients who had COVID and found out that those patients that were admitted, patients who had that type of gum disease were more likely to be admitted in hospital at their intensive care unit, to be put on ventilator, and even lose their lives. So that report came out only about a few weeks ago. So indeed, one must take good care of one's health.
Thank you very much, ma. I'll say go back to the same question, the same question, somehow related. Is there any difference between gingivitis and periodontitis?
Yes.
And how can we prevent both?
Periodontitis is just a continuation of gingivitis.
Okay.
Gingivitis is the one that starts first. And that's the one, once you see the gums red and is bleeding, the mouth may be a bit smelly. And of course, if there's bleeding into the mouth, the taste of that blood too may alter the taste in the mouth. So what really causes it? The main cause of it is what we call dental plaque, or now newly called oral biofilm. And the best and the most consistent way to get rid of that dental plaque is by toothbrushing twice daily, morning and night before you go to bed, with a fluoride-containing toothpaste to strengthen the teeth, and of course to clean in between the teeth, because the brush misses those areas sometimes, and that's why you tend to have many holes in those areas in between the teeth. So we say that at least one must floss once a day, possibly maybe in the evening after you've had your last meal, and then one can brush. Also, we also advise, to prevent, that one should visit the dentist twice yearly. If you can't do that up to 2 times, come at least once a year. And of course, we will always encourage have a healthy, low sugar diet, less consumption of harmful alcohol taking too as well, and of course, avoid smoking.
Thank you very much. I'll come to you, doctor. Oftentimes we see people get into the hospital to have their tooth extracted or tooth extraction done. On some occasions, they may go for filling. What could be the difference between the two? Is it all the time that people present probably with hole in the tooth that will require extraction? What will inform the decision to go for filling or extraction? Thank you very much, sir.
Thank you very much, impeccable presenter.
Thank you.
I want to say that it has to do with the individual. It is a time of presentation of the condition that determines the level of care that that patient will receive. And that's why in my earlier introduction...
Just a minute, I will interrupt you a little. Okay. Jack from
Hello.
Lagos. Jack, good morning.
Good morning, sir.
Yeah, you're welcome to the show.
Thank you very much, sir. Yeah, I am watching you guys right now at home, and I'm really enjoying what you guys are talking about. Dental health is a very vital thing we should take seriously, especially here in Nigeria. We don't really take care of our mouth the way we take care of our body. You see people buy cream of 10,000, 20,000, but when it comes to their oral health or when it comes to taking care of their teeth, they don't take or give that much attention to it. So I just say I should call and applaud you people for the wonderful job you're doing, and I say thank you very much. You're doing a great job.
Thank you very much. We appreciate you. Thank you. Continue, sir.
So talking about it is the time the patient presents at the clinic that determines the level of care that the patient will receive. And that's why we are appealing profusely and making it very clear that the very first thing, we all know that prevention is cheaper and better than cure. So you don't need to wait for you to have pains or to have holes in your mouth. Without any complaint of any kind, present yourself at the dental clinic every six months. And when you come, within that time, we'll do the oral examination and be sure that your mouth is in good condition. At least that will take you to the next 6 months. But if you have any complaint, another thing is, when you have complaint, don't wait until you get to the climax of the complaint. Now it's disturbing your sleep, you cannot sleep, the pain is excruciating. Or by the time you come, definitely that tooth will be removed. So let me quickly answer your question now. You know, the tooth is made up of 3 layers: the enamel, the dentin, and the pulp. And the enamel is non-living. When you have holes at the level of enamel, the patient will not feel any form of either symptoms when either he or she takes cold or warm food. But when the tooth decay gets to the dentin, it becomes very, very sensitive. And that's when the patient brushes, or when the patient takes hot or cold drink, will have one form of sensitivity or the other. If the patient presents at that point in time, we can do root filling. We have different kind of tooth filling materials that we can use. We have what we call the tooth-colored materials. Because all over the world now, we are trying to phase out the normal silver-colored, we call it amalgam, phase down. So what I'm trying to say is, if you present at the level of dentin, then we'll fill the tooth. But when the tooth decay gets to the pulp, of course, at that point in time, you may not be able to, well, there's another form of treatment, we call it root canal treatment. You remove all the living part of the tooth, you fill it with an inert material, and then you can now crown the tooth, and you still leave the tooth in that patient's mouth. Number one, that's quite expensive, and it's a bit extensive. And if the patient cannot afford that, definitely at that level, we have to extract the tooth. So basically, present to the dental clinic or as early as possible. Don't wait until you have pain or the pain is disturbing your sleep. Avail yourself, just like what the first caller just said. We spend a lot of money to have luxury, but we've forgotten that your mouth is one of the greatest assets you can have.
George from Plateau, good morning.
Good morning, sir.
You're welcome to the show.
Thank you very much. I'm appreciating your program.
Thank you, sir.
People are really educating us in respect of how to take care of our health. I want to ask a question because I had a statement from somebody that fluoride does not really benefit the mouth. And also, how do you connect your mouth breath, that is mouth smelling, with your tummy? Some people say your tummy, the mouth smelling comes from your tummy. Some say it is from your mouth. So I want the guests there to really educate us in this aspect. I appreciate your program. Thank you and God bless.
Thank you very much. Thank you for calling in. We appreciate you too. Prof, over to you, ma.
Yes, I will start with the second question about whether your bad breath coming from your tummy. Ideally, what we try and do when any patient comes and says, oh, they have bad breath, we first of all make sure that there is no problem in the mouth. Once there's no problem in the mouth, then it could come from a few places. It could come from the nose, it could come from your lungs, it could come from the gut or the area where you eat. Now, in terms of the areas where you eat, sometimes you have what we call reflux. Reflux, in other words, the food is coming back up. that could also cause bad breath. Then some foods that one eats, people who eat onions, of course, it will cause bad breath or onion breath. And then things like garlic.
Yes, yes.
And of course, there could also be some cancers going on along the gut too as well. Those two could also predispose and tell one that, oh, there's a problem somewhere and it needs to be investigated. So that is with the bad breath coming from the tummy. Then with fluorides, well, it is well known. It's been, many researches have been done, and we've seen that caries, even when the caries or the dental decay begins, and you use your fluoride toothpaste, it stops it. It stops the decay from going on, because one part of the fluoride interacts with a substance on the tooth surface, and that makes it even now more stronger. So that is why we still recommend a toothpaste with containing fluoride. I know there have been issues. Some people have been saying that it may cause cancer and other. It is still not well documented and well known yet. In fact, in some areas in the country, like in Maiduguri, they have very high content of fluoride in their water. Now, when you see them, their teeth look a lot much whiter, like snowflakes on the teeth. So in those areas, and they haven't complained that there's a link between that white teeth and possibly cancer. So until we see that, for now, it is still regarded as safe.
Thank you very much. I was wondering, fluorinated water, is there anything like that?
Yes, there is. We have a lot of food being fluorinated. We have water,
Milk.
even salt, milk, and they're really healthy, and they're quite beneficiary to our general health. In fact, when we talk about fluoride, there's a particular level you should have in the toothpaste, and that's why the Nigerian Dental Association, we have taken that responsibility for any toothpaste that is not endorsed by the Nigerian Dental Association. I will advise the whole populace not to patronize such toothpaste, because we'll make sure that the particular level of the toothpaste fluoride should be contained in that, especially most of our herbal toothpaste, because most of those herbal contents cannot really stay with the fluorides, and that's why you see most of the makers, they don't even reckon with, and they will tell you you don't need to have fluoride in their toothpaste. But I'm saying that is extremely wrong. Fluoride up to this point is not harmful to the body. It is very, very extremely beneficiary even to our oral health, and we take fluoride in different forms, in salt, in milk, even in our water.
Yeah, thank you very much. Back in the days when there used to be Molue on Lagos routes or roads, we usually see hawkers coming in to sell some powders that they say once you use it, it can bring out all the worms that are hidden in your teeth. And sometimes they do the demonstration, and people will see worms. People will be gathered in a place, see some worms crawling out of people's. How real is that? And how effective could such a powder be? Is it advisable that people should patronize such people? Thank you very much, sir.
Number one, we want to wonder what is the contents of such powder. I'm not trying to destroy anybody's product here, but we're talking about research and the mop-up of the problem of those who engage themselves in using that kind of powder. What we've seen over the years is that such powder, they don't really have much dental value because of what they are being made up of. They are very, very abrasive, and when they use the powder for a long time, they come down with abrasive kind of lesions. You see their teeth almost worn off. Some of them, you have cervical abrasions, and at the end of the day, most of such individuals before age 40, 35, they are edentulous, no teeth again in the mouth. I have a very close person, I wouldn't want to mention the whatever here, close, very, very close relation that engages in using, ceramic plates. When you have breakable plates, when they are being destroyed, they will grind it to powder, and they use that particular powder to wash their mouth. Before age 50s, I can remember very well, that individual became a dental and started using full denture. So I would not advise such.
We have Charity from Lagos. Sorry to stop you, sir. Good morning, Charity.
Good morning.
Yeah, please go ahead.
I would like to speak with the nurse, with the female nurse.
Okay. She's hearing you.
Yes. I'm having problems. I brushed well, and I've bought different kind of clothes-up, even expensive ones, and I've bought some mouthwash. I've gone to some dentists, but I'm still having the same problem. I'm having mouth odor. At the same time, my breath is the same problem from my breath too. So I don't know what to do. And I brush twice a day.
Yes. I think you will need to come and see us. It's a good thing that you're brushing twice a day. Like I said, gum disease. Gum disease, we have what we call pocket formation between the gum and the tooth. Now, in that pocket, germs and food may be packing in there. And of course, if it is not removed, it can cause bad breath because your brush cannot reach there. Also, like I said earlier, the bad breath could be coming from elsewhere. It may not even necessarily be from your mouth. So that is why you may need to come and visit any dentist to have it checked if it's still persisting.
Thank you very much, ma'am.
Thank you very much. Please, I don't know if I can get your address and your phone number.
Yes, it will be shown on the foot. Just keep watching. It will be displayed on the footnotes that will be going as we are going on with the program. Okay, yeah, you can see that.
Is it her personal number or address?
That's my address.
That's her address.
Her personal address where you can locate her. Is out now.
Yes.
Okay, the one with Prof. Omowunmi.
Yes, that's Professor
Omowunmi Ayanbadejo. Okay.
Yes.
All right, thank you very much.
You're welcome.
I really enjoyed the program. Thank you very much.
Yeah, thank you very much. Talking about brushing, let me ask this practical question. We should be done first in the morning. Brush our teeth or have our breakfast?
Let me before Prof talks, I'll just want to allude to that. She is an expert in that anyway. But where I'm going is a matter of preference, and it has to do with the last thing you were able to do before you go to bed.
Okay.
Some can eat before, some can take food before brushing their teeth, and they will not have any problem with their tummy. There's nothing bad in that. The only thing is, if you after taking that food and you refuse to brush your mouth before going out or getting to the afternoon, that's where the problem lies. But if you don't have any problem, you can wake up, take your food, and then later you brush. But for some of us, if you try that, of course, your tummy will make noise, so you want to make sure you brush even before you put anything in your mouth. But what we've discovered, what the research has really shown us, if you're able to brush as the last thing before you go to bed in the night, definitely when you wake up in the morning, your mouth will be sharp, will be bright. You can eat before you now brush. So I don't know if there's anything she wants to add to that.
Can someone, before she adds, can someone probably have breakfast and then afterwards brush?
Yes, you can do both, because I know culturally, most people have been told that you brush your mouth once you get up.
Yes.
There's no harm in that. But the best thing is to brush after food. If you don't want to brush twice in that morning, brush after the food. Just like our caller rightly said that, she may be having bad breath. You have eaten something, and that food may be trapped in between the teeth. And of course, sometimes it may begin to decay and begin to release offensive odor. So, of course, in such instances, brushing after a meal is much better.
Thank you very much. We are not yet done. You're going to demonstrate to us a good way to do the brushing. But we'll go on a short break and we'll be right back. Thank you. Please go nowhere. Welcome back to the show. We are glad to have you back. I will give Prof an opportunity to demonstrate to us how we can safely brush our teeth.
Yes. So when it comes to brushing, in the morning, preferably after your meal. But if you must do it before, there's no harm in brushing twice in the morning.
Let me take you back, Ma, a little. What type of toothbrush should we use?
Yes. The type of brush...
For children, for adults, for elderly individuals.
Okay. They have children-sized brushes. They are slightly smaller than that of adults. And they are even indicated. But we advise the use of a soft or medium bristled brush to be used. And of course, the handle must be in a way where it doesn't slip. It shouldn't be too smooth so that it doesn't slip when you're holding it. So what we'll do, we take a fluoride-containing toothpaste and put it on the brush and try and brush in an organized way. So we either start from either the right or the left, whichever one you feel comfortable. But it's better to walk it around the outside and then walk it around on the bottom and then on the inside. So what we normally do is we put the side of the brush and sweep it down. Sweep it down for the upper tooth. We sweep it down, sweep it down, sweep it down, sweep it down, sweep it down. Change our brush to the other side and sweep it down from the gums and sweep it down. Then for the inside too, sweep it down, sweep it down, sweep it down. For the bottom teeth, we are sweeping it up. We are sweeping it up. This way of brushing, we call it the roll technique or the physiological up and down. The same thing on the inside. Then we now scrub the biting surfaces. We scrub that one, and then of course all over before we finally now brush. Before we finally brush the tongue. Okay. In addition, in the evening, we should also clean in between our teeth. This, what I have here, is called a floss holder. It can come in a string, and when you're going to use it as a string, you just take about a ruler and a half and roll it on one finger and then be undoing the finger to apply it in between the teeth. One introduces it in as far as it can go on one side of the tooth and gently bring it downwards. Then the other side of the tooth, you rock it and then bring it downwards. And then you do it in every space like that. If it is difficult to get to the back, then that is where the string, the rolled string, may be a bit helpful. That helps rather than this one. But this one tends to be much easier. This for people to use. And this is what we call a flosser. So that is what we do. We brush twice a day, morning and last thing at night. And then you floss too, at least in the evening. If you cannot floss during the daytime, floss in the evening. Thank you.
Thank you very much, Ma. Now, is it advisable, one more question before I leave you, Ma. Is it advisable for children to use only toothpaste that are usually categorized age 1 to 2 or 3? Can children use toothpaste that are made for adults?
They can, but if they are going to use it, it must be very small. You said the pea, the size of a pea is what they use. That's what we
What
we
quantity
advise.
of toothpaste should we add to the brush? Must it cover the entire surface?
It can take the length of the brush.
Okay.
It can take
Doesn't
the length
matter.
for an adult. It can take the length, but it shouldn't be more than that.
Okay.
Shouldn't
Thank you
be more
very
than
much.
that.
You want to add something to what she has said, sir?
Well, what she has said is extremely perfect. You use the pea size for the children. If you cannot get the one
For children.
marked for children, you can use any form of, any form of the adult toothpaste that contains fluoride. And you just want to add that you need to change your brush every 3 months.
Yeah.
And if you discover that even before the 3 months, the
Bristles
are really wobble, you want to change. You don't have to wait until that 3 months. You want to change it so that you have
Just a minute. Adebayo from Ondo. Mr. Adebayo, good morning, sir. Oh, so sorry we lost that call. Okay. Now, for children that cannot use brush, what can mothers do to help keep their tooth clean?
I'm just wondering what will make a child not to use the brush. Is it
Age? Of course, age too.
age? Oh, the mother will help the child in brushing the mouth.
If the child is under 1 year,
Under 1 year, we can use cotton wool or another thing to bring the toothpaste to the mouth and make sure you do effective clean, even with that either foam or the cotton wool.
Even babies too. They can use a clean cloth and put it in some water and use it to clean them, or salt in warm water, a little salt and warm.
Yeah, thank you very much. And I also would like to ask you, how can oral diseases be diagnosed?
Yeah. Basically, it takes the same principle with other ailments or diseases in the body. When you come to the clinic, you want to listen to you, take a very, very good history. You tell us the way and manner you feel. After that, after the history, we examined you. When we carry out all our examination, that will now help us to know the kind of investigation, because we're not going to expose you to all the gamuts of investigation that is available to other diseases. So your complaint and in alliance with our examination will determine the kind of investigation you carry out. And that investigation...
Sorry, Adebayo is back. Good morning, Mr. Adebayo. Yes. No, I think he's there. Good morning, Mr. Adebayo. Oh, okay. Go ahead, sir.
So, when we now the investigation will now determine whatever the outcome of the investigation will help us to draw what we call treatment plan, which eventually will tell us what and what we want to do for it. But I quickly want to chip in this. To our policymakers, I want to passionately appeal that we need to pay more attention as to how we execute, how we take care of the general populace when it comes to dental treatment. I'm not trying to...
Just a minute. Good morning, Mr. Shegu from Ogun State.
Yeah, good morning, sir.
Yeah. Please go ahead with your question, should you have any.
Yeah, I have a question. Sir, there's this thing we grew up with. They say you use salt to brush your mouth. I would like to know how hygienic that is. Is it good to use, or we should stop using it?
Thank you very much. Prof, you want to take that one?
Yes. Using salt, it's a bit too harsh, particularly for the gums. Also, because it is a form of abrasive, it is also like a plate-like this. So if you continuously use it, it will wear the tooth on its own. However, you can put salt, a level teaspoon of salt, in a glass of warm water to control areas where there is redness in the mouth, and where you are unable to brush. That can be a supportive thing. But the main thing to remove the germs in the mouth is by tooth brushing and flossing. All others are just supportive, are just an additional thing to help you when you have sores. But it's not something you should be doing all for the rest of your life. No, it's not advisable.
Thank you very much, sir. So you can continue.
Yes, talking about policy making, we need to do more. I would like to say that, well, I've not been paid for this, but being part of them for some years back, Lagos State they really tried as dental clinics in Lagos. They've put a lot of things in place. Recently, we met with the the Health Service Commission body, and the promising is quite fantastic, trying to identify those areas where we don't really have dental clinic, not just having a building, but having the facilities. Dental chair is quite expensive. And apart from that, when you talk about health insurance scheme in Nigeria, please, it's been even the HMOs, the health management organizations, it's not been encouraging as per, the way they handle dental treatments and all that it takes in this part of the world. We need to do more to encourage our dentists so that we're able to take care of the oral health needs of the Nigerian population. For example, we have the oral health scheme at the national level, which when we look at the policy, there are landmarks of things to be done as the year goes. And over 10 years, I remember it was launched, the oral health policy was launched in November or October 2012. And up till this point, we can't really see visible things.
Thank you very much, sir.
So
Prof, I'll give you a minute to round up. But before that, I want to ask, are there programs put in place for this year's World Oral Health Day in the department?
Yes,
Okay.
there have been programs. We had a video that has been going viral. There are also activities to celebrate the day. Hashtag Mouth Proud. If one goes online with that hashtag, one would see the activities where you can frame your mouth and be proud of your teeth, your smile, for healthier life and longer life.
Thank you very much. It's on that note, I want to say a very big thank you to Professor Omowunmi and, of course, the doctor who came with her, Dr. Akanbi. You're both welcome. Hopefully, we'll have you some other time. We'll see you next week. Bye-bye.